approaching winter. Now in its 7th week, the ceasefire between Israel and Hamas has yet to meet its stipulated goals. Reconstruction of Palestinian homes, that has not begun, nor has there been any real influx of food or medical supplies. Gaza's civil defense says that the ongoing fuel crisis is threatening operations to rescue victims of Israel's attacks and delivery of humanitarian aid. The UN says that 1.5 million residents of Gaza are in urgent need of shelter in preparation for winter. Israeli forces have destroyed more than 80% of buildings. The onset of heavy downpours that has left thousands of makeshift tents in ruins. The land where civilians have been allowed to reside appears to be shrinking too. Palestinians have accused the Israeli army of expanding the Yellow Line. It refers to 53% of territory that the Israeli military have been granted control of under the current ceasefire. But the largely invisible demarcation line, it's basically a few yellow blocks, has allegedly been moved hundreds of metres in some areas. Let's go live now to Gaza City. Our correspondent there is Ashraf Shannon, and I'm sorry to have to outline on that, but for our viewers, they need to understand just how dire the situation is on all fronts, in terms of the fact that the area that people are living in is shrinking. The places where they live are deteriorating. They're just tents. There's hardly any buildings. There's hardly any lifelines in terms of food and water. And on top of all that, sorry to mention it, but as I understand, Israel does continue to attack at times in and out of the Yellow Line.
Yes, Neil, unfortunately that despite the start of the ceasefire, Israeli violations continue. And among those violations, of course, Israel not allowing enough aid to reach the Gaza Strip, especially shelter equipment. Among these violations, also the daily killings of people. Earlier today, they shot and killed a young man in Khan Yunis in southern Gaza near the Yellow Line. Already more than 340 people have lost their lives since the start of the ceasefire. More than 100 of them either near or inside the Yellow Line. And this Yellow Line, as you mentioned, is expanding, and the areas where people can live in the Gaza Strip is shrinking literally by the day, as every day Israeli forces push those yellow blocks further, either west in eastern Gaza or south in northern Gaza, making life really difficult, extremely difficult for people. People in the eastern parts of Gaza City say by evening time they can't get out of their tents because they're afraid of the Israeli quadcopter drones that continue to fire at them, and from Israeli snipers who keep shooting at anyone who moves in that area, although it's outside the Yellow Line. Of course, since the start of the ceasefire, Israel has been allowing less than 200 trucks of aid to enter the Gaza Strip, and they allowed around 50,000 tents to reach Gaza. Well, according to officials here in the Gaza Strip, including the civil defense, Gaza needs some 400,000 tents just to give some kind of shelter to the displaced population because of the war and the destruction, Neil.
Ashraf, thank you. Ashraf Shannon, our correspondent on the ground in Gaza City. The official death toll of Palestinians killed during Israel's assault on Gaza, it currently stands at just below 70,000. But a new study released by the Max Planck Institute for Demographic Research shows that the true figure actually could be much higher. Researchers say the number of Palestinians that have been killed in 2 years of war likely is in excess of 112,000. Their estimate of unaccounted victims was drawn from the Gaza Health Ministry's data, independent household surveys and social media reports. More than a quarter of those killed are believed to have been children. The study also reveals the staggering impact on Israel's war on life expectancy. The average age of women, that is said to have plummeted from pre-war averages of 77 years down to 46. Life expectancy for men dropping from 74 to 36. Let's get more on this now from Dr. James Smith. He's an emergency doctor and lecturer on humanitarian studies at University College in London. Welcome to you, Doctor. And I want to start just with some of the numbers that I just mentioned. Average age dropping, not just a bit, dramatic, halving practically for some people. This suggests to me older people in Gaza have actually been especially affected. Is that because perhaps they're the most vulnerable to the humanitarian conditions that we're seeing?
Well, what we're seeing actually, the study and others that have preceded it have looked at the age and sex distribution in mortality, so Palestinians that have been killed in Gaza. And what they have identified is that there is a particularly high risk of death across the age course, and regardless of whether you are male or female. And what they say explicitly in their study is that this correlates with previous research in historical genocides. So what we're talking about here, of course, is a context of genocide. This is not war or armed conflict. And it's particularly important that we use that language, but also that people in the health sciences space, the public health space, use that language as well. And arguably, and this has been said by many others, not just myself, the public health community has a lot to answer for its failure, really, to act more decisively with respect to Israel's genocide in Gaza. So the point that I'm trying to make is that we are dealing with a very different type of situation here, one where people, regardless of whether they are very old or whether they are newborn babies, face a phenomenally high risk of being killed, because that is the aim of genocide, to destroy in whole or in part a population, in this case on the basis